Hi guys, welcome back to my channel. Thank you so much for tuning in. Today's video is about intern year and tips and tricks that I have for you in order to be successful as soon as you start intern year. One of the things that are really hard to get used to and master during intern year is rounds. You're now in charge of your own patients and you have to present, and that information is actually really important in order to formulate a plan for the rest of the day. And a lot of times you're presenting to your fellow co-residents, you're attending, and this information is used in order to examine the patient and focus on what needs to happen in order to manage this patient best. And so rounding can be really intimidating when you first start because you have so much information overnight that could have happened that you don't know anything about, and then you come into the hospital like really early and you have to prep quickly for rounding, and then when you round you're expected to know everything that needs to be known about your patient. And so it can be really stressful and difficult to navigate, but I do have some tips and tricks for you so that you can manage rounding better. And basically, if you follow this flow that I always use in order to prep for morning rounds, then you will be really successful. And once you get the flow down, it's much faster for you to get through all of the patients. So no matter, how little or how much is on your patient roster, you can still manage to go through everybody, get all of the important information, and make sure that you round correctly so that one, you could be impressive, and two, and more importantly, so that you can better manage your patients. And so basically the first thing that I do when I walk into the room after you get sign out from the overnight resident to figure out what happened overnight. Don't expect the sign out to be super complete. They're basically, the overnight resident is in charge of so many patients. So all they're going to report to you is if anything happened overnight. Like let's say a patient became delirious and had to be given some medication in order to calm the patient down. They'll probably tell you, around 3 a.m. I got a page from the nurse and the patient was ripping off their leads and was really agitated. So we had to give them 5 of Haldol. So that would be an important event that the night resident signs out to you, and you have to of course write that down so that you can update the team about this finding. But you also have to do your due diligence in the morning to figure out what happened overnight, because the night resident is not necessarily going to update you about absolutely everything. And so the first thing that I do when I sit down is I log into the computer. After I've gotten sign out, I've written everything that happened overnight about my patients, and the first thing that I will check on my patients is their vitals. Vitals are super important to check. You check their vitals overnight, you check their vitals for the last 24 hours. If you're using an EMR computer system, like we use Epic. Epic is really nice. It gives you like a nice vital summary over the last 24 hours. And you want to look for flags, anything that's out of the ordinary. If your patient was cruising at 120/80 for the last 3 days, and then all of a sudden overnight they shot up to 180/100, you want to investigate and make sure that you report that there was a difference in that, and make sure that that was an accurate reading, nothing was happening at the time, and then maybe inquire a little bit more about what happened. And so vitals are really important. It's also important to know if your patient spiked a temperature. A lot of times that could warrant further investigation, like you want to figure out why that patient had a fever, and so making sure that you check on their vitals. You want to really look for temperature, blood pressure, heart rate, respiratory rate. Those are super important and should be the first step in checking on your patients. I usually write down if there's anything that was abnormal over their on their vitals, and then note that and make sure that I report that or investigate a little bit further if it warrants. The second thing that I always do is check on labs. A lot of surgical services like mine, we order really early morning labs, and I hate waking up patients for labs, but it's really important to trend labs for a lot of different patients for different reasons. And so if a patient came into the hospital and were hospitalized for a huge deep space infection that got drained, it's really important to trend their white blood cell count. And so every day you want to draw labs to make sure that their white blood cell count is coming down, which means that the infection is being properly treated. That's one of the signs. And so making sure that you look at today's labs and make sure that when you check and you see the labs that they are in fact today's labs. A lot of times if the labs haven't resulted salted or drawn, you'll see yesterday's labs and you'll write them down, and sometimes that's not very accurate. So be very diligent about checking the dates. And a lot of times I'll always write down the labs for my patients, and that's a lot of times expected to be on the list that you may print and give to everyone. And so we always write down the lab values, and I'll write down today's labs in like a little fishbone that maybe I'll show you guys. The different ones that I use are right over here. These are really, really helpful. One is for just their white blood cells and their hemoglobin and their platelets and their hematocrit, and the other one is their basically Chem 7 panel, and then there are other ones that you can use, but these are the two most popular ones and should be on every single one of your patients if they have lab drawn. And so I will write the lab value, and then right next to it in parentheses I'll write yesterday's lab value, and that's really helpful because you could see, you know, is this patient's hemoglobin downtrending, and if so, why is the patient losing blood? Or is their white blood cell count downtrending, and if so, that's great because we're treating them for an infection. And so those are really important. Labs are super, super important. So that's the second thing that I always do. The third thing that I always do is go to the microbiology and imaging tab. I see if they've gotten imaging overnight. Sometimes if a patient spikes a fever overnight and they're getting worked up, they'll go and get a chest x-ray. That's super important to know and to be able to report during rounds. And so I'll always check, see if there was anything. If it's a trauma patient and they're getting CT scans of the head every single day, you want to make sure that you're keeping an eye on that as well, and to see if there's been any changes. And so that's super important. So I always look at imaging to see if anything happened overnight. Most of the time, nothing happens overnight. Imaging happens during the daytime, but it's always important to check just to be sure and thorough. The second thing that I'll check is microbiology. A lot of times if you have an infection patient and you draw blood cultures or you've swabbed anything from the infection site, that doesn't result right away, and it takes a couple of days for the cultures and sensitivities to come back. And so it's really important that every day in the morning I always check to make sure, did anything result overnight or early this morning? And so that is always my third step. My fourth step is to always check the notes. Did anything happen overnight? Did any service, whether they're a consult service or, you know, an event or something like that, a lot of times people are really good about documenting, especially if things are happening at night. So I always go to the notes tab, check to see if anybody dropped any new note that I should be aware of. A lot of times if it's the same patients that I'm carrying, I've read their notes from yesterday, so this doesn't end up being a long task because it's just the things that I didn't end up getting to, so it would be like anything that happened overnight. So that's really important to update on. And a lot of times I'll use it as a refresher too, like what did other services say? Like if my patient, you know, if we had a consult from neurosurgery and we had a consult from ortho and we had a consult from, you know, hemonc, I want to know and refresh and remind myself. I go down to the recommendations, see what the services said, so that if my attending during round says, oh, what did neurosurgery say about this patient? I've just gotten a quick refresher. And so notes is definitely on my to-do list bright and early in the morning. The last thing that I do, and this is probably the most important thing that I always do, is I always talk to the overnight nursing staff. That is so, so important. So many people do not utilize this. Someone in residency at some point taught me that nurses are the most important tool that we have overnight, and they're incredible resource. And if you don't utilize your other team members, then you're really missing out and you're not able to actually report everything that happened with the patient, especially for patients who are in the ICU. They usually have, their nurse is like incredible and is usually on top of it and knows everything that happened with the patient, knows if they got blood overnight, knows if they went to x-ray, knows, you know, what are all of the different teams that are coming in. A lot of times nurses will ask, you know, what do you guys think is going on? And so they'll actually know before the consult team was able to even drop a note, they'll know what's going on. A lot of times nursing is what gets me through rounds, because a lot of opportunity is missed if you don't talk to the overnight nurse. And so that's super important. A lot of times I don't like to wake up patients in the morning before rounds because you're not going to get much from them. They're sleeping, they're really tired, and I think it adds stress to their body to wake them up so many times in the night, especially if I'm getting 4 a.m. labs and then I'm going to round on them at 5. Like, they're not getting any sleep, and we're going to go round on them as a team anyway. So I will still go to the room and talk to their nurse, but I will not wake up the patient. Some attendings do want you to pre-round, so make sure that you check with your team, your attendings, and your chiefs, and figure out what they want want from you, but if it's up to you, then don't wake up the patients. It's so important for them to get sleep, and you're gonna see them when you round on them as a team anyway. And so do use that opportunity though to talk to their overnight nurse, who is a huge resource and knows so much more than, you know, anyone else, because they've been so intimate in taking care of these patients. And so those are really my 5 tips. So just to go over it again, the first thing you want to do after you get signed out from your night resident is check vitals. The next thing that you want to do is check labs. The next thing you want to do is imaging and micro. The 4th thing that you want to do is check the notes. And the 5th and last thing that you want to do is talk to nursing. And the reason why I say talk to nursing last is because usually I do all my computer stuff first. I log in, and then I run to the room and talk to the nurse, or sometimes you can even call if you're able to just reach the nurse directly as well. But they are not in like order of importance. I do all of them all the time. And so if you do all 5 of these things, you'll be super prepared to present your patient. One other thing that I will add, one thing that sometimes I will also check is to make sure that patients are taking the medication that they're supposed to be taking, because sometimes that changes overnight. Like let's say they had standing orders of oxycodone, and that was only, so that patient is only supposed to take it for severe pain, and they took 2 doses overnight, but 2 days ago they never took any. That means their pain is increasing, and there's got to be a reason for that. So a lot of times I will check the medication, but the reason why I kept that all the way at the end, and I don't think it's as essential as everything else, is because a lot of times you run out of time, and going through all of their medications is sometimes a difficult thing to do in the morning. And so if you have time for it, definitely do it. But if you don't have time for it, everything else that I list is really important to do first. And so that's kind of, you know, a little caveat that I will throw in there, that medications do become important overnight, to know that a patient is requiring something different. But if you don't have time for it, just save it for a task in the middle of the day so that you could do it and then update everyone at the end of the day. So that's it, you guys. I will do a lot more tips and tricks as an intern, but if you want to know anything in particular or very specific, please comment below. Let me know what questions you have, and share with me what you've done during intern year to help you survive as well. As you know, I'm an oral and maxillofacial surgery resident, so I did OMFS intern year, and I'm doing general surgery intern year. So lots of intern years, and I feel like I'm finally getting the hang of all of it, but everything's a trial and error. So make sure, you know, you do your due diligence, figure out what works best for you, and talk to a lot of people and gain knowledge from other people's experiences. But don't forget to subscribe to this channel, like, and make sure you guys turn on your notifications so you know when I post a video next. And if you want to follow me for everyday posts, don't forget to follow me on Instagram at 15blades. Thank you so much. Don't forget to subscribe, and I'll see you next time. Bye.